Hey everyone, welcome to Lunch and Learn. Today we are going to talk about positive steps to make to ensure the success of your next attempt to take boards. So this is the beginning of a series that I'm going to be doing to be able to hopefully encourage a few tweaks to the habits that you've been doing in order to be more successful. We know that taking boards more than once is so expensive and it's stressful to you, as far as having to go home and take what in the RT world is kind of feels like the walk of shame, and that is not leaving there with the credential, and we don't want that to happen to you. So we want you to be successful, to get that pass rate, to not only pass with the 88 for the TMC, but go ahead and qualify for the CSE with that pass rate of at least 94 or above. We'd love to see everybody pass with a score over 100. So let's get you up and running as far as better habits to get you prepared and better base knowledge. And that's kind of what it's all about, is using that laser-like focus and really taking into consideration what have we done before that maybe we could have done better to prepare ourselves. What knowledge base do we need to expand in order to have a successful trip to take the test and to get to work basically at the highest hourly rate that you can in the setting that you want to be, no matter which aspect of respiratory that it is. So when we're taking the test, we need to learn how to break the question down. And we do this when we're doing the reviews with Jana or I. We break the question down, or the CSE down, into little bites, and into fractions. And we use what we've learned when we've played Jeopardy and when we've spent time studying. We use those bits and pieces of knowledge and we bring it all together to answer that question accurately. So when we're looking at these questions, there's a few things that we need to make sure we're doing. And that is, let's make sure, first of all, that you're recalling the fundamentals. Well, you can't recall the fundamentals if you don't have them in your knowledge base. So you need to know the normals for a CBC. You need to be able to look at an ABG and decide what reflects ventilation, what reflects oxygenation, how can we get that pH back in normal range, and how do we know what modality that we can use that will help us do that in the most efficient manner. So it may give you several answers to the question or several choices to the CSE, but you've got to know which one is the best answer. And sometimes you really got to watch that wording. Look for key words. And when you know the difference between what should the RT recommend and what should the RT do first, take your time. I've had a few people answer questions on the wall that they've chosen an answer that may still be correct and would still be helpful to the patient, but the question has the words, what should the RT do first, in it. And so we have to be able to prioritize of what's the best answer. What should the RT recommend out of several options? Another thing the test does is they may have several answers, but they may not list the very best answer that may be in your knowledge base. You may know the best thing to do for the patient, but sometimes they leave that very best answer out of the question on purpose. So you will choose the second best answer. And what they're testing there is your ability to critically think. Okay? So make sure that you have that strong foundation and knowledge base, and you just do that by repetition, by going over the normals, by going over what is normal cardiac output, what are my normal hemodynamics, and having those stationary in your mind. If you've got to record yourself talking about those subjects, do that. Everybody has a smartphone now. If you've got to record your own reviews, do that. But there are so many tools on YouTube, on Google, that we offer so many on our pages that you should be able to listen to, or you should be able to watch and read, that you should have no problem building any kind of foundation and finding where are the cracks in your foundation, basically. Where are the pieces of your knowledge base that's missing? And only you can do that. Okay? So constantly quizzing yourself, reading, using laser-like focus, using your drive time to listen to reviews, using your gym time, put on a video or put on an audio review, using time while you're cleaning house. Just put on your pods or your headphones, or just let it play if you're home by yourself and it don't drive or if your family's home and it don't drive you crazy. While you're doing laundry, be listening to something that's going to help you get your score up. Every minute that you can spend truly focused and listening and just bringing it into your daily routine so you can get this information solidified is going to help you. And just think, you may spend the time doing laundry listening to something that's going to boost you 2 points. Then you may spend the time doing dishes listening to something or watching something that's going to boost you 2 points. That's going to add up. Making sure that you attend every single video or every single presentation and conference call that you can with us is going to do nothing but help you. So let us know what you need and where you feel like those cracks in your foundation are, and we can point you in the right direction. So another idea to help you is, when you're looking at these questions and scenarios, choose what is the most cost effective. So is it better, can the patient do incentive spirometry or an easy PAP to help with pulmonary hygiene? If they're alert and oriented and teachable, they can do that before you order the CPT. That's either going to be costly if you've got to have a vest system to do it, or some other type of equipment, or if you're going to have to use Dornase Alpha, which is an expensive mucolytic, or can you use sodium chloride to help that patient cough and clear? Or can you use acetylcysteine, which is still cheaper than Pulmozyme? So you've got to know kind of in your head what things cost and how invasive are these situations. Another thing you don't want to do is choose something that's more invasive than you actually need. Can you do a BiPAP for a patient as opposed to intubating and mechanically ventilating? And think about it for your own sake. If you're being proactive with that blood gas, and you can use a BiPAP or NPPV to reverse that situation before you have to intubate, mechanically ventilate that patient, that's better in a lot of ways. It's better, it's less traumatic for the patient, it's less costly for the facility and the patient, and it requires a lot less clinical input over the next few days, as far as managing the ventilator, managing the weaning procedure. It puts them at more risk for having to go through a tracheostomy procedure. If they are a chronic patient, if you can't get them weaned, then they're going to be at a greater risk for having to be trached or maybe go to a long-term facility, when you could have used NPPV early on to reverse that respiratory failure, and then gotten the order and taught the patient how to use NPPV to do it at home. You can have a huge effect on your patient's quality of life based on your ability to recognize the signs and symptoms of respiratory failure and intervening quickly, and then thinking of the least invasive and that taking the pathway of least resistance and complication in order to keep that patient in a state of the closest homeostasis you can based on their disease process. So also what's very helpful with making choices as far as questions and scenarios is deciding, will it delay therapy? So you've got to decide, is this an emergency situation? Or is this something that I can treat with a slower care plan that is not currently emergent. So you could have two asthmatics come into the emergency room. One of them could be in a status asthmaticus situation. You do the blood gas and you do the assessment and you decide we've got to intubate, mechanically ventilate this patient right now before we end up coding them. And then the other asthmatic can be, you've got to recognize the signs, symptoms, and do the assessment. And they're more stable. They're not in an emergent situation. So you've got to learn the steps and be really solid with what can I recommend in this situation to solve this before this patient becomes as emergent as the patient we just mechanically ventilated down the hall. So you want to try to find your patient, assess where they are, and how can you reverse whatever is causing them to be in the situation. Do you need to use emergency steps and invasive ventilation, or can you give them some continuous albuterol, some Solumedrol IV, and some oxygen to bring them back out of that situation before it becomes emergent? But you've got to look at your question on boards and decide, where is this patient in this scenario? Are they emergent or are they stable and just need some help reversing where they are? So being able to look at your results and of your assessment and make those decisions is absolutely a necessity to passing these exams and to being successful in your career. So you've got to use that laser-like focus and study and build your knowledge base till you get to where you can do this. So you've got the hard part done. You've already made it through school. You've already made it through a ton of tests, of weekly exams and finals, and you've made all these sacrifices, so you're almost there. So just keep working hard to get over these humps and get your own personal knowledge base that only you can build. Using the tools you have, and we're here for you, but we can't come to your house and make sure you're studying, and we can't sit down beside you and make sure that you understand these concepts, but we can be on the phone with you. We can offer things on the wall, and we can offer live presentations and things like that to help you get there, but it's your responsibility to really make sure you have that knowledge base down, okay? So being able to decide if I choose a chest x-ray at this point, or if I choose a CNS, sputum CNS, is that going to delay treatment and cause the patient to get worse while you're waiting on some test that it's going to take time? I mean, you can't send somebody with a pneumothorax for a CT scan. You've got to treat that right then, and you've got to know where to put that equipment, what to use, and according to whether it's a pneumothorax or if it's a pleural effusion, you've got to know what works and where to insert that therapy. So as far as what rib and what area of the chest wall needs to be treated. So make sure that you're able to make the best decisions according to that patient's exact current status. Know your lab values to decide, is this a metabolic issue, or is this a respiratory issue? Is this an asthmatic that I'm looking at, or a COPD, or is this somebody in diabetic ketoacidosis? Know the key words that's going to point you in that direction. Is this patient's saturation and PO2 truly out the roof, or did they just come in from a house fire or some kind of exposure to carbon monoxide, and am I looking at erroneous information, and do I need to throw on a non-rebreather in order to correct this, or is this truly a saturation of 100 and a PO2 of 150, or am I looking at something that doesn't know the difference between carbon monoxide and oxygen currently on the hemoglobin? So you've got to have that concrete and solid in your understanding. Another thing is watching your key words. Make you a list of key words and go over them and make sure you understand them. And we use them often in our reviews. So knowing that when it says a marked situation, that it's emergent. Knowing that when it says fluffy infiltrates, bat wing, butterfly wings, that you're looking at CHF. Knowing that when it says that the trachea has shifted away from the current problem, that it's happening outside the lung, between the chest wall and the actual lung, and knowing which ones do that. Know that's a pneumothorax or a hemothorax, or know that's a pleural effusion, or something is in between the lung and the chest wall that's pushing the trachea away. And then know the difference. If it says that it's pulling it toward the affected side, know that something is happening inside the airway. It's atelectasis, or something inside, as far as like maybe it's just a huge tumor, or it's some type of obstruction, and it's going to pull that toward the affected side. So all of those bits and pieces that we go over constantly on the wall, and that we go over during Jeopardy and during conference calls, and every attempt that we make, all those bits and pieces can come together. So make sure that you are using the tools that are at your fingertips. Remember, there are enough videos to probably not go to respiratory school if you watched all the videos that are online, and you could build your own respiratory education with everything that's available on YouTube. So use those resources. Make sure they're credible, but when you're doing dishes or you're doing laundry or something, you may be able to boost your score by a few points by listening to something educational, as opposed to listening to the latest release from your favorite artist. That will still be there for you to listen to after you get through respiratory boards. So just hold off on spending that time watching the latest music awards, and go ahead and spend that time studying. Use that laser-like focus and doing your normal day life activities to work in every bit of study time and review time that you can. So, well, thanks for listening to this Lunch and Learn. I hope you have a great day. Look for more coming up. Thanks. Bye-bye.